This comprehensive guide will prepare you for success in your hospital attendant job interview. From understanding the role to crafting perfect answers and following up effectively, we'll cover everything you need to make a strong impression and secure your position in healthcare. Hospital attendants are vital healthcare team members who provide essential non-medical support to patients. Understanding the scope of this role is crucial for interview success. Patient support. Assisting with meals, personal care, comfort needs, and emotional support during hospital stays. Hygiene maintenance. Ensuring cleanliness of patient rooms, changing linens, and assisting with personal hygiene tasks. Patient transport. Safely moving patients between departments for tests, procedures, and treatments. Critical skills. Empathy and compassion for patients in distress. Meticulous attention to detail for safety protocols. Strong teamwork abilities with diverse healthcare staff. Physical stamina for long shifts and patient handling. Hospital profile. Research the hospital's size, specialties, reputation, and recent news or achievements. Mission and values. Understand the hospital's mission statement, core values, and community initiatives. Protocols and procedures. Familiarize yourself with common hospital protocols for infection control, patient handling, and emergency responses. During your interview, reference specific aspects of the hospital's mission or values that resonate with you. This demonstrates genuine interest and shows you've done your homework. Hospital managers evaluate attendance based on both technical qualifications and essential personal qualities that ensure patient safety and satisfaction. Reliability. Consistent attendance, punctuality, and willingness to cover shifts when needed. Calm under pressure. Ability to maintain composure during emergencies and high-stress situations. Effective communication. Clear communication with patients, families, and healthcare team members. Compassion. Genuine care and empathy for patients in vulnerable situations. Adaptability. Flexibility to adjust to changing priorities and unexpected situations. Resume essentials. Highlight healthcare experience, even volunteer work or caregiving for family members. Emphasize transferable skills from customer service or hospitality roles. Include specific examples of patient care or support responsibilities. List relevant certifications prominently, CPR, first aid, CNA, etc. Documents to bring. Multiple copies of your resume. List of professional references. Original certificates and training documents. Photo ID and social security card. Immunization records. TB test results, if required. Notepad and pen for notes. Professional appearance. Clean, pressed business casual attire, slacks skirt with button-up shirt or blouse. Conservative, closed-toe comfortable shoes. Neat, professional hairstyle with hair away from face. Minimal, conservative makeup if worn. Clean, trimmed nails, short length for patient safety. Limited jewelry, small earrings, simple necklace, watch. Important don'ts. Avoid strong perfumes or colognes, many patients have sensitivities. Skip excessive jewelry that could interfere with duties. Don't wear scrubs unless specifically instructed. Avoid clothing with controversial logos or messages. Remember, your appearance demonstrates your understanding of healthcare professionalism and infection control considerations. One-on-one interview. Traditional format with a hiring manager or department supervisor asking questions about your experience and qualifications. Typically lasts 30 to 45 minutes and focuses on your resume and behavioral questions. Panel interview. Multiple interviews, often including nurse manager, HR representative, and current attendants, evaluate you simultaneously. Make eye contact with each panel member and address questions to the entire group. Scenario-based interview. Interviews present hypothetical patient situations and ask how you would respond. Test your problem-solving skills, knowledge of protocols, and decision-making abilities. Practical assessment. Demonstration of basic skills like bed making, wheelchair transfers, or vital signs measurement. May include a shadow period with current staff to observe interpersonal skills. One of the most common scenario questions asks how you'd handle challenging interactions with upset patients or worried family members. Situation. Describe a specific situation with a difficult patient or family, e.g., family upset about long wait times or confused patient refusing care. Task. Explain your responsibility in that situation, maintaining calm, ensuring patient safety, addressing concerns. Action. Detail the specific steps you took, active listening, empathizing, explaining procedures, involving appropriate staff. Result. Share the positive outcome, de-escalated situation, improved patient experience, lesson learned. When a patient's daughter became upset about her mother's meal being late, I acknowledged her concern, explained the delay was due to an emergency, and immediately checked with dietary services. I brought the meal quickly and followed up later. The daughter appreciated the communication and prompt action, turning a potential complaint into a positive interaction. Surgical preparation is a critical responsibility that requires attention to detail and strict adherence to protocols. Be prepared to explain this process step by step. Verification. Check patient identification, name, DOB, ID bracelet. Verify surgical site and consent forms. Document allergies and last meal time. Patient preparation. Assist with hospital gown change. Remove jewelry, dentures, contact lenses. Clean surgical site if instructed. Monitoring. Check and record vital signs. Ensure NPO, nothing by mouth, status. Document baseline assessments. Transport. Transfer to gurney with proper technique. Secure patient with safety straps. Deliver to pre-op with complete documentation. Pressure ulcer stages. Stage 1. Intact skin with non-blanchable redness, usually over a bony prominence. Stage 2. Partial thickness skin loss with exposed dermis, presenting as a shallow open ulcer. Stage 3. Full thickness skin loss where fat is visible but bone, tendon, and muscle are not exposed. Stage 4. Full thickness skin and tissue loss with exposed bone, tendon, or muscle. Prevention strategies. Reposition immobile patients every 2 hours. Use pressure redistributing mattresses and cushions. Keep skin clean, dry, and moisturized. Ensure adequate nutrition and hydration. Inspect skin daily, especially over bony prominences. Use proper lifting techniques to avoid friction shear. Document skin condition each shift. Ensure safety. Position yourself near the exit, maintain safe distance, and remove potential hazards or weapons. Communication techniques. Use a calm, quiet voice, simple language, and non-threatening body language with appropriate eye contact. Identify triggers. Ask open-ended questions to determine what's causing distress, pain, fear, confusion, medication effects. Seek assistance. Know when to call for help from security, nursing staff, or the rapid response team if de-escalation isn't working. When encountering an agitated patient, I focus first on remaining calm myself. I introduce myself clearly, use the patient's preferred name, and speak in a gentle, reassuring tone. I validate their feelings while setting clear boundaries about acceptable behavior. Hand hygiene. Wash with soap and water for at least 20 seconds. Use alcohol-based hand sanitizer when soap unavailable. Perform before and after patient contact. Follow WHO's 5 moments of hand hygiene. Personal protective equipment, PPE. Know proper sequence for donning and doffing gloves, gowns, masks, and eye protection. Equipment disinfection. Follow hospital protocols for cleaning shared equipment between patient uses. Isolation precautions. Understand different types, standard, contact, droplet, and airborne precautions. Reporting. Know when and how to report potential infection outbreaks or breaches in protocol. Physical privacy. Knock before entering rooms. Close doors and pull privacy curtains during care. Cover patients appropriately during transport. Position computer screens away from public view. Verbal privacy. Speak quietly when discussing patient information. Use private rooms for sensitive conversations. Address patients by preferred name, not condition. Never discuss patients in elevators or cafeteria. Information security. Log out of computers when not in use. Never share passwords or access credentials. Dispose of patient information in secure bins. Report privacy breaches immediately. I always treat patient information as if it were my own. HIPAA isn't just a legal requirement, it's about respecting the dignity of each person in our care. Proper waste management prevents infections, protects staff and patients, and complies with environmental regulations. Be prepared to describe the different waste categories and handling protocols. Sharps waste. Needles, scalpels, broken glass. Dispose in puncture-resistant containers. Never recap needles or overfill containers. Biohazardous waste. Blood-soaked items, bodily fluids. Place in red bags with biohazard symbol. Double bag if exterior contaminated. Pharmaceutical waste. Unused or expired medications. Follow specific disposal protocols. Never flush or throw in regular trash. General waste. Non-contaminated items. Regular trash bags or recycling. Keep separate from other waste types. Effective prioritization strategies. Assess urgency. Determine which tasks involve immediate patient safety or comfort needs. Create task lists. Use written lists or hospital task management systems to track responsibilities. Communicate with team. Check in with nurses about changing priorities and ask for help when needed. Reassess regularly. Frequently reevaluate priorities as new tasks arise or situations change. Self-care during busy shifts. Take scheduled breaks to maintain energy and focus. Stay hydrated and eat nutritious meals, snacks. Use proper body mechanics to prevent injury. Practice deep breathing during brief moments. Communicate when workload becomes unsafe. I manage multiple priorities by always putting patient safety first, maintaining open communication with the nursing team, and using a small notebook to track tasks. This helps me stay organized even during the busiest shifts. While hospital attendants aren't primary operators of complex medical equipment, you should be familiar with basic monitoring devices and patient care equipment. During interviews, emphasize your experience while acknowledging your scope of practice. Vital signs equipment. Blood pressure cuffs, manual and automatic. Thermometers, oral, tympanic, temporal. Pulse oximeters. Mobility devices. Wheelchairs and stretchers. Gait belts and transfer boards. Mechanical lifts. Patient care equipment. Hospital beds and controls. Call light systems. Bedside commodes. It's perfectly acceptable to admit when you're unfamiliar with specific equipment, but emphasize your willingness to learn and follow proper training protocols. Active listening. Give full attention, maintain eye contact, and avoid interrupting. Confirm understanding by paraphrasing what you've heard. Clear communication. Use simple language without medical jargon. Speak slowly and clearly, especially with elderly patients or those with hearing impairments. Empathetic responses. Acknowledge emotions, use therapeutic touch when appropriate, and validate concerns without making false promises. When communicating with patients and families, I always introduce myself, explain what I'm doing, and ask if they have questions. With confused patients, I use simple directions, gentle redirection, and sometimes visual cues to enhance understanding. Discussing your strengths. Empathy. I connect easily with patients from all backgrounds, which helps them feel more comfortable during difficult times. Attention to detail. I notice small changes in patients' conditions that might signal discomfort or complications requiring nursing attention. Resilience. I maintain a positive attitude even during challenging situations, which helps both patients and team members stay calm. Addressing weaknesses constructively. Limited equipment experience. While I'm still building experience with specialized equipment, I'm a quick learner who always follows proper training protocols before using new devices. Anxiety under extreme pressure. I've learned to manage stress by taking a brief moment to breathe deeply and prioritize tasks when multiple demands arise simultaneously. Interview question. Describe how you would handle a medical emergency while attending to a patient. Assessment. First, I would quickly assess the situation to determine if the patient is conscious, breathing, and what symptoms they're displaying. Alert. I would immediately activate the emergency response system by calling the code or using the emergency call button while staying with the patient. Assist. While waiting for the response team, I would provide basic life support within my scope of practice and follow any instructions from nursing staff. Document. After the emergency, I would document my observations, actions taken, and the time of events to support proper medical documentation. This response demonstrates your emergency preparedness, teamwork abilities, and understanding of protocols while staying within your scope of practice. Common behavioral questions. Describe a time when you had to handle multiple tasks simultaneously. Tell me about a situation where you had to adapt to an unexpected change. Share an example of how you've gone above and beyond for a patient. Describe a mistake you made and how you handled it. How have you resolved a disagreement with a coworker? Conflict resolution example. When a coworker and I disagreed about the best way to transport a patient, I suggested we step away from the patient's room to discuss it privately. I listened to their concerns about patient comfort, while explaining my focus on safety protocols. We compromised by using my suggested transfer method but incorporating their ideas for making the patient more comfortable during transport. We both learned from each other's perspective, improving our teamwork going forward. When answering behavioral questions, use the STAR method: situation, task, action, result, to provide complete, structured responses that showcase your skills and experience. Questions about the role. What is the typical patient-to-attendant ratio on this unit? How is the team structured, and who would I report to directly? What does the orientation and training process look like for new attendants? How is success measured in this position? Questions about growth. What opportunities exist for additional training or certification? Do you offer tuition assistance for employees pursuing healthcare education? What career advancement paths are available for hospital attendants in this organization? Before the interview, research the hospital thoroughly: services, values, recent news. Practice answers to common questions out loud. Prepare 3 to 5 specific examples of relevant experience. Print extra copies of your resume and reference list. Plan your route and arrive 15 minutes early. Turn off your phone completely. During the interview. Body language. Maintain good posture, make appropriate eye contact, offer a firm handshake, and avoid nervous habits like pen clicking or hair twirling. Communication. Speak clearly, take a moment to think before answering difficult questions, and use professional language without medical jargon. Attitude. Show enthusiasm for the role, demonstrate adaptability, and express genuine interest in the specific hospital and its patients. Sample thank you email. Subject: Thank you or hospital attendant interview. Dear Ms. Johnson, thank you for taking the time to interview me yesterday for the hospital attendant position. I enjoyed learning about Memorial Hospital's patient-centered approach and the important role attendants play in the patient experience. Our discussion about the challenges of balancing efficiency with compassionate care reinforced my enthusiasm for joining your team. My experience with elderly patients and attention to detail would allow me to contribute effectively to your department. I look forward to the possibility of working with you and your team. Sincerely, your name, phone number. Follow up best practices. Send a thank you email within 24 hours of your interview. Personalize your message with specific details from the conversation. Restate your interest in the position and briefly highlight key qualifications. Keep the message concise and professional. Proofread carefully before sending. If you don't hear back within the time frame mentioned, a polite follow-up call or email is appropriate. A thoughtful follow-up demonstrates your professionalism, attention to detail, and genuine interest in the position, all qualities valued in hospital attendance.